A 3-year-old child is brought into the emergency department with a sore throat and generalized red sandpaper-like rash. He has had a fever and complained of a sore throat for the last couple of days, and the rash erupted in the last few hours, initially starting on his chest and spreading to his limbs. What is the diagnosis? Options are A. Rubella, B. Measles, C. Fifth disease, D. Scarlet fever, E. Roseola infantum. Answer is D. Scarlet fever. Initial clinical features may be non-specific and include sore throat, fever, typically greater than 38.3 degrees Celsius, headache, fatigue, nausea, and vomiting. A blanching rash usually develops on the trunk 12 to 48 hours after initial symptoms, before spreading to the rest of the body and flexors. The rash is characteristically red, generalized and pinpoint, punctate, with a rough, sandpaper-like texture. It may be accentuated in the skin folds of the neck, axillae, groin, elbows, and knees with a deep red, linear appearance, so-called Pastia's lines. The palms and soles are typically spared. The skin may peel after the rash resolves, particularly at the tips of the fingers and toes, and less commonly on the trunk and limbs. Examination may also reveal strawberry tongue. Initially, the tongue is covered with a white coat through which red papillae may be seen. Later, the white covering disappears, leaving the tongue with a beefy red appearance. Associated cervical lymphadenopathy. Flushed face, with marked circumferal pallor. Pharyngitis and small red spots, petechiae, on the hard and soft palate, Forchheimer spots. A 2-year-old boy is brought to the emergency department with a 2-day history of an itchy rash around the nose. You see a yellow crust over several lesions around the nose. What is the recommended management for this patient? Options are A. Topical acyclovir, B. Oral flucloxacillin, C. Topical fusidic acid, D. Topical hydrocortisone, E. Oral amoxicillin. Answer is C. Topical fusidic acid. For localized non-bullous impetigo, consider prescribing hydrogen peroxide 1% cream. Apply 2 or 3 times daily for 5 days. For people who are not systemically unwell or at a high risk of complications. If this is unsuitable, prescribe a short course, 5 days, of a topical antibiotic, offer fusidic acid 2%, apply 3 times a day for 5 days, or mupirocin 2%, apply 3 times a day for 5 days, if fusidic acid resistance is suspected or confirmed. A 54-year-old woman presents to the emergency department with a 6-hour history of a painful right leg. She has a past medical history of type 1 diabetes mellitus. On examination, you note the calf is red and hot to touch. You suspect acute cellulitis. Her observations are recorded as heart rate 112 beats a minute, blood pressure 149 by 67 mmHg, respiratory rate 20 breaths minute, temperature 37.8 degrees Celsius. How would this presentation be classed according to the Aron classification? A. Class 1, B. Class 2, C. Class 3, D. Class 4, E. Class 5. Answer is C. Class 3. Class 1. There are no signs of systemic toxicity and the person has no uncontrolled comorbidities. Class 2. The person is either systemically unwell or systemically well but with a comorbidity. For example, peripheral arterial disease, chronic venous insufficiency, or morbid obesity, which may complicate or delay resolution of infection. Class 3. The person has significant systemic upset, such as acute confusion, tachycardia, tachypnea, hypertension, or unstable comorbidities that may interfere with the response to treatment, or a limb-threatening infection due to vascular compromise. Class 4. The person has sepsis or a severe life-threatening infection, such as necrotizing fasciitis. If cellulitis is diagnosed, the severity can be categorized using the AARON classification system to help guide management decisions. A 3-year-old boy is brought into the emergency department with a 2-day history of a widespread, itchy red rash. You are able to diagnose chickenpox. The child's mother is 15 weeks pregnant. Which of the following is not a typical feature of fetal varicella syndrome? Options are A. Hypoplasia of the limbs. B. Dysfunction of bowel and bladder sphincters. C. Microcephaly. D. Cataracts. E. Patent ductus arteriosus. Answer is E. Patent ductus arteriosus. Complications in pregnancy. Varicella in pregnancy can result in severe chickenpox. The mother is at increased risk of varicella pneumonia and other complications compared with the general adult population. Infection with varicella zoster during the first 28 weeks of pregnancy can lead to intrauterine infection and fetal varicella syndrome, which is characterized by one or more of skin scarring in a dermatomal distribution, eye defects, for example microphthalmia, chorioretinitis, and cataracts, hypoplasia of the limbs, neurological abnormalities, microcephaly, cortical atrophy, learning difficulties, dysfunction of bowel and bladder sphincters. A 4-year-old boy is brought to the emergency department with a 1-day history of rash following a sore throat. You diagnose scarlet fever. What is the recommended school exclusion period for scarlet fever? Options are A. 5 days from onset of rash. B. No exclusion period necessary. C. 24 hours after starting treatment. D. 3 days after rash has resolved. E. 7 days from onset of rash. Answer is C. 24 hours after starting treatment. Exclusion from nursery, school, or work is needed for at least 24 hours after starting appropriate antibiotic treatment. An 8-year-old boy is brought to the emergency department with a non-blanching skin rash that appeared first on both his feet and has spread to the back of his legs and arms over the past 24 hours. Prior to the rash developing, he had episodes of abdominal cramps and diarrhea with a small amount of blood. He is afebrile, alert and well in himself with normal observations. What is the diagnosis? Options are A. Meningococcal septicemia. B. Hereditary hemorrhagic telangiectasia. C. Acute idiopathic thrombocytopenic purpura. D. Henots-Cunlane purpura. Von Willebrand disease. Answer is D. Henots-Cunlane purpura. Henots-Cunlane purpura, HSP, is the most common vasculitis of childhood, occurring predominantly between the ages of 3 and 15 years and affecting the small vessels. HSP is characterized by the classic tetrad of rash, abdominal pain, arthritis arthralgia, and glomerulonephritis.